Hey, everybody. We are live. How y'all
What's up? What's up?
doing?
What's up? What's up,
Hey, good
ladies? What's up,
evening.
sir? How you doing?
Good. I'm
Everybody feel all right?
excited. I'm excited tonight. We got some guests. So,
Woo!
we got our first guest. Y'all are our first guests on the show.
Really?
Yeah. Y'all are our first guests on the show. Look at y'all. Look at y'all. Get to be the first guest on the show. I'm excited to have y'all because I know y'all are gonna bring some really good information for us this evening. So,
Try
before
to.
we get started, ain't no try. You know y'all gonna bring some good information per usual. Y'all always got good information when I'm talking to y'all about other stuff. So I don't think this will be any different. Um, how's everybody's day been today?
It's been
Pretty
been
good.
good. Been good. I mean, I've been focused. I've been focused on the election today. That's what I've been
Yeah,
focused.
a lot of people have.
I'm all about the election too. I'm watching it now.
You you watching it now? You keeping up with everything?
Yes, and I will give y'all updates as they need to be given if something drastically happens or
Okay.
something drastic happens. I'll let
I appreciate it because one of my phones is down, so I got this shit.
Oh, that works
I got
perfectly.
you. Don't worry about it. I got you.
That works perfectly. What was that?
Shout out to everybody that went out and voted today. We appreciate y'all. Everybody that didn't get out and vote today, fuck you.
It's only 8:03, sir. 8:03.
you
And some
know,
people just don't believe in the power
Excuse
of
me.
voting. So we can't say
Forget
F them.
forget
I
you.
was just
We have
gonna
to
say,
respect their decision not to vote.
like everybody, it's not. People have their difference of opinion about voting, so you just have to let that be.
So that's
Um.
my opinion on them not voting.
Well, all right. Anywho, thank y'all for joining. Thank y'all for hopping on here and chopping it chopping it up with us tonight on Health is Wealth. We got two special guests in the building, and these are our first guests on the show. We haven't had any guests on the show in the last couple of weeks, so thank y'all
You're
for
welcome.
hopping on here and being a part of the show tonight. We got Mr. Damone, who is an insurance broker and retirement specialist. I got that right?
Yes, ma'am. Yes,
All
you did.
right. Hey, look at that. And then we have Miss Tiffany Splunge, who is a certified registered nurse and clinical educator,
Yes, ma'am.
aka my beautiful cousin. So we are gonna hop in. We're gonna make sure we got everybody on here. Somebody said, "Where's Trost?" Trost is working late tonight. He had to work over, but he will be joining us in the
See, there you
second
go.
hour of the show.
There you go. That
So,
bullshit. Don't lie. We cannot lie to our people. Trope took the detox medicine and he stuck on the toilet. Right? He'll be.
boy,
Stop it. Stop it.
I'm gonna keep it real with you.
don't
100.
pay no attention to the
You
mouth.
got the booty drink.
We are not gonna pay no attention to the mouth. We are gonna hop into our topic of the evening, where we are talking about health is wealth. For those of you who do not know, there are a lot of things happening in the world right now, and then especially on today. Like today is a big day for a lot of things that are going on: presidential election, local elections, and things like that. So a lot of our people are pretty much on edge, and but also even going into the fall months, we do have to be mindful of other things that are going on around us, like our health. We are still dealing with those COVID numbers that are increasing again, which is why certain places across the country have shut back down. So we needed to let y'all know that it is important. It is very, very important for everybody to make sure that they are tending to their health in a lot of different ways. So we got Miss Tiffany that is going to help us figure out how we can better take care of ourselves, try to be COVID free, and get our bodies and immune systems in a better place. Because some of us still don't take care of ourselves as much as we could with COVID being prevalent and running rampant. And then we got Mr. Damone, who is going to give us some tips and information on insurance so that we are not the ones out here setting up GoFundMes and things like that. Because if you are prepared and ready ahead of time, you don't have to worry about getting ready when it's too late or close to the point where you cannot prepare. And we all want to leave our families something. We all want to leave our families a legacy and leaving something behind for them. So here we are. We got some good information coming. So get your notebooks and pens and papers ready, because I'm pretty sure there are some people on here that will have additional questions for you, Mone, as far as types of insurance and things like that. So we're going to ask a few questions, but I know we'll have other people that probably have questions in the comment section for you as well. So we got our boy the Mouth here tonight. We got Miss Cat. We got David Ruffin, aka Joy Antoinette Kane, Miss Three Names, on here with us this evening. And me, your girl Leo Rochelle. So thank you all for joining us. Thank you all for hopping on. If you have not followed the Phat Girl Chronicles page, make sure you go on and do so on Facebook, YouTube, Twitter, Instagram, and pretty much every social media platform there is. You can find us. And if you cannot find us, feel free to Google us or reach out to us on Facebook. You can find me under Leo Rochelle or Tiffany Rochelle on Facebook. And then I'll lead you to where you need to be to get to the promised land. All right. So make sure you check us out. And we are going ahead and hop on in here. We're going to talk about a little bit with the COVID.
Cousin. Well, thank you guys for joining us tonight, man, because this is an anti-GoFundMe show tonight. We're gonna stop the GoFundMe funeral.
It ain't it's not anti-GoFundMe, because GoFundMe is good for other things, but we definitely want to make sure that
as far as funerals are concerned.
Yeah, we definitely don't want that to be our
808?
main.
Stop it.
We don't want that to be our main source of being able to tend to our family's needs and things like that.
Definitely.
So we just have to make sure that we are well prepared ahead of time. Even if we don't have insurance right now, it's never too late until it's too late. So, cousin, Miss Tiffany.
Yes.
So we see that Chicago is pretty much going back down on lockdown. Am I correct?
Yes.
And the COVID numbers have increased. Can you give us a little information on how people can protect themselves and what type of things they can do in order to make sure that they are in a good space health-wise as far as, being protected from COVID?
Well, ever since COVID has started, they've been pushing the issue as far as social distancing, wearing your mask, hand washing, and so forth. But you still have some people who just refuse to believe that COVID is real. And I work at a hospital, a level trauma 1 hospital. So I always say for those people, they should put those people into the hospital and let them care for the COVID patients. And then they'll have a different intake on the importance of wearing your mask, practicing social distancing, and hand washing. And it's sad to say COVID is going to be around for a while. It's going to be around for a while. It's not going anywhere anytime soon. So you would think that how long we've been dealing with it, since March, pretty much, that it will be
March.
Yeah, it will be routine for everyone. And which for me it has, because I'm a healthcare provider. But however, a lot of people still refuse to. So it keeps getting spreaded. And the only sad thing about COVID is that it's not something that you get exposed to it and then you have symptoms like that day or even the next day. You can develop symptoms within like 2 to 14 days after being exposed to it.
Oh, wow.
Yeah. So just think about it. You've been around somebody who's exposed. Okay. Now you can have symptoms or you cannot have symptoms and still spread the virus. So it's hard to backtrack who you've been around, grocery stores, at work, any type of human contact, because it takes too long for you to develop symptoms. So when they try to do like
Tiffany,
the
can I ask you
traces,
a question?
sure.
Oh, I'm sorry. I didn't mean to cut you off. I thought you were at a stopping point. So you talk about the mask, and I will admit I am one of those people that those masks get on my nerves. I feel like I can't breathe in them. I feel like I'm suffocating. Is there one mask that you recommend that's better than the other ones? Because people have the little white and blue disposable ones, and then there are the cloth ones, and then now there's the one with these big hole vents on it. Which, in my mind, I'm thinking if they got vents and holes, like, what's the point of that? Because stuff is still getting in. But like, I have not found nothing that I like, and I be in the store like this with my mask holding it away from my face. I don't like it. So, is there a difference between the different types of masks, and is one better than the other one?
Well, yes, it depends on the mask. You have a lot of people who are making them now. Some come in cheap material, some come in good quality material. The good quality material, obviously, you're going to pay more for. So, I had a mask like this one. Okay. So I bought this one from a girl off of Facebook, and I like this one because it's triple layered, and for masks, in order for proper to prevent you from getting exposed, it should be triple layered. But this one also, you can put a filter inside that'll also help protect you as well. So anything that's triple layer or more, it gives you the better protection. And the proper way, of course, is wearing it over your nose. You have too many people that I've seen that wear it over their mouth. I'm like, okay, but you're still breathing in the particles. So what is that actually doing? And even if you have it, you're still spreading it too. So yeah, they're not fun to have. They're not fun to wear, but you just have to wear it when you're out in public or if you're around people. And even now, the COVID rates are increasing, and it's not because like grocery stores and they're trying to say that people are catching it from dining out in restaurants, but actually small gatherings. You have families that's catching it now. And even back when it first started, they were saying about children. Children can get it. Yes, children can get it. The symptoms may not be as bad as an adult. It will have an effect on an adult, but yeah, some children can get it as well.
So that's kind of similar to a cold, like when an adult catches a cold from a kid, like the adult is like down. Because I used to work in childcare, and when I would catch a cold from those kids, it would be like, Lord Jesus, help me! I'm on my like. I think he coming on the chariot this evening, like because the kids' germs is like totally different, and so
it's like mutated germs. They got the strongest little germs on the planet.
And I mean,
weird.
they would take me down after I caught a cold from the kids. So it's pretty much kind of the same way. The kids will have it, but it won't be as bad as an adult.
Right.
Okay. Yeah.
But the mortality rate is higher in adults.
Yeah. Okay.
And even when it first started, they said that it was higher with people who had like pre-existing conditions. Now, a normal healthy person can pass away from it.
Mm-hmm.
So you really don't know.
What about people of color, Tiffany?
They are doing research.
Because that was a myth in the beginning that people of color was not as likely to get COVID, but I know I can probably count at least 10 people of color that have passed away allegedly from COVID. Mm-hmm. So is that myth need to be debunked, or is that
I heard we was more susceptible.
It was initially out there when it first started that people of color wouldn't be affected as much.
I thought they said we were more susceptible because of the preconditions.
Right.
Diabetes and blood pressure and all that stuff we got going on in our community. I heard that it was more prevalent for us to catch it than the white man.
Mm-hmm. But Ms. Cat is right. In the beginning, they were saying that, we were almost like immune to it, we couldn't catch it. But now we're more likely to catch it because of our pre-existing conditions, like diabetes, hypertension, obesity. Because we lead the charts as African Americans.
So that adds to the statement of people talking about what they call systemic racism. because they try to play us like, oh, y'all can't get it.
Mm-hmm.
So we walk around with our mask on, then we the one getting and dying from it.
Mm-hmm. I know a lot of people who've passed away from it. Too many.
I lost my mother in June from it.
One of my mother's very best
I'm
friends
sorry.
died yesterday from it.
And my brother just called me, and one of
Oh.
his cousins, my best friend, I call him my brother, but his cousin passed today from it. So it's real. I think people that walk around and be forgetful and a little loose with it, they haven't been affected immediately. It hadn't been immediate family or anybody very close to them, so they still feel like, oh, it's just a thing going on. You know, we're gonna be all right. No, it's serious.
Mm-hmm. It's very real, very real. And I'm speaking as a person who care for these patients. It's very real.
And I can believe that. And I think some people like passed away before we actually knew what it was. Like, my aunt passed away like earlier this year, like March, end of February, beginning of March. But, you know, they said it was because of a heart attack or whatever. But she had all the symptoms that they came out with after the fact. Like after she passed, they started talking about all the symptoms, and she had pneumonia and a bunch of other things that happened. And so it was like, did she have COVID, or we weren't really sure. Like, that was before they had started giving it a name and started actually diagnosing it and saying what it was and things like that. And so the place that she lived in, there were other people who actually ended up passing away after the fact. So it was like, did she really pass away from COVID, or did she pass away from, you know, heart complications, which we knew she had other things going on, but it was like, was it what they said it was, or was it something else? And so I'm definitely a person that's like, I'm staying my ass at home as much as possible. Like, I'm gonna go to the grocery store, I'm gonna come home. I have been to a gathering or two, but I'm like, yeah, I'm gonna make sure I go right on back home, and you know, and I'm quick to come out of clothes that I've been outside in. I'm not in my house in outside clothes. You know, and I know several people that had it when it first happened, and honestly, I think I had it when, you know, stuff was going on, because I got sick and out of nowhere, like at the very beginning of March, around that time frame.
I remember you telling me about that, coming from the strip club at that time, but you didn't feel good.
Jesus, I cannot. Okay, I have one more question.
You weren't supposed to tell nobody. That was our secret.
Hey, but we got a lot of great comments in. I want to talk about one thing. He said so he wanted. It was a question for you, Tiffany. So is it airborne, or is it just touch, or both?
It's both.
Both. Okay.
It's both.
And I think a lot of people know that, but I think a lot of people may not know that. So I thought that was a good question. Yeah.
No, it's both. If I would give my opinion.
And then he also followed up and said, do you believe Chicago is ready for a worst case scenario?
No, absolutely not. I don't think we have.
I don't think anywhere is.
No, we don't have the healthcare manpower to handle it. Like where I work at, most of our ICUs are already filled.
Wow.
So
I have a cousin
too. So no, we are not ready.
I have a cousin who's a nurse in Mississippi, and when it first started, it was so bad at the hospital she was at. They were getting long supplies because it was just backed up with people. And I asked her about it because at one point she was so overwhelmed, because the unit she actually works in she works with the babies, and she took a picture and what she had to wear, to where when she was just normally she would have on her scrubs, gloves, you know, the usual. Now she's like in this suit of armor almost. And she had to tell one of the doctors, because she had to get used to it. She said, I have to step out because I'm going to pass out in this. Because it was hot. It was a bunch of them. They under the lights or whatever. And she said, it's the conditions that the people that have been doing this for a while, it's not the same. It's forever changed at this point. I had to go to the emergency room a couple weeks back, and I've seen nurses get off work. They look tired, but they now look exhausted because of conditions from going simply just like delivering a baby, a simple task, you wear your scrubs, whatever, to now this plastic head thing situation and dealing with other people that will not stay home. That was when my cousin said, she was like, they coming in here for tummy aches. Stay home. Take Pepto-Bismol. It's nothing we really can do. And I noticed a different shift even with me at the R. The stuff they would take away and do wherever they were doing in front of me, and I'm like, this is our protocol now, because we have to move fast. Because you can't sit, you got to sit out space. It's just nuts at the hospitals. People that are in the medical field, I pray for you all daily, because you all are superheroes at this point. You basically are.
Yeah, I agree with that. So thank you, Tiffany, for everything that you do and everybody else that's like literally in healthcare in the front lines. I have one more question and I'm done. So my question is regarding COVID, because things like this are very mysterious to me. And you know how the other pandemics that we had in history, like the bubonic plague and the Asian flu or influenza, or some of these major things that it's like things that took out people. What was one of the fevers? But it was like you get like day 1, 2, 3, you get these symptoms, and 4 through 7 is these, and then 8 through 10 is these, and then whatever, you probably die by day 12. But I feel like with COVID, it's like, what the hell? You know, it's like there's no set thing that is the same in any exact person, because like you said, people are asymptomatic. They have all the symptoms, they can transfer it, but they never get sick. Then there's some people that I know one person that got sick or diagnosed positive on a Thursday, died on a Sunday. There are some people that get diagnosed, they stay in the hospital on life support for 3 months, and then they miraculously or get better. So it's like, is it different strains that are coming out, or is it just so like nobody really truly knows exactly what it is, even though they're saying they know what it is? Because it's not like any other major global pandemic that we've ever had before.
It's not. And see, the thing is that everything keeps changing every day. So the CDC keeps doing research and they keep coming up with new findings. So that's why the symptoms aren't the same in everyone, even like caring for them. They first talked about giving Plaquenil and Zithromax and vitamin D and zinc and so forth. But now even all that is changing. Now, I don't personally work in an intensive care unit, but talking to some of the ICU nurses, they always say that once the patient goes on the ventilator, the chances of survival is really slim. And one of my best friend actually had COVID, her and her whole family and her kids too. So I kept pushing her. So she had it the worst out of everyone. And COVID resembles it resembles the flu. It resembles like a normal cold. So basically, I've never had COVID, and I pray that I don't get it. But I have like a map set out on how to try to beat it in case I do, because I've been dealing with it for so long. So the only thing I can advise is that if you do get it, you have to have Motrin, Tylenol on hand. Take your vitamin D to keep your vitamin D levels up. Take your vitamin C and take your zinc. I've also added sea moss to my daily regimen.
Yeah, it's about that immune system.
So you have to stay active.
I think Kat was a little concerned about her throat.
Her throat?
Her throat, yeah.
Her throat. So,
I'm fine, thank you. It was a reaction to the smoke, but I am actually keeping an eye on my cough and my breathing, but I do think it was just a reaction to the smoke. Thank you.
So Ms. Sanchez had a question. She said, what are your thoughts if someone gets COVID at work? Should the place shut down or do a deep cleaning, or just clean and carry on with opening a business as usual?
It just depends on where you work. If it's a restaurant, then obviously I would hope that it will shut down and do a deep sanitation, and then test out employees. But if it's a place that can't shut down, like where I work at a hospital, the person who has been affected is quarantined at home. And then everybody else just monitor for symptoms while they still come to work. So it just really depends on where you work. I've known people who worked at factories and an employee was tested positive, and they shut down the whole plant and did like a deep clean, and everybody had to get tested before they come back. But the only thing is the sad thing is that COVID, your symptoms don't come right away. So even if you are exposed, let's just say you get tested within like 3 days from the date of you being exposed, and it's negative. Okay, now what if you still don't have symptoms, but here it is 10 days later, you positive. Now you've been around everybody, you've spreaded all these antibodies to people, all these germs and stuff. Now you've affected so many people. So that's the only thing that I don't like, that the symptoms do not come right away. People who are asymptomatic spreads it.
I had a question about that. Like I hear people saying that they're symptomatic or whatever. So is this more like the people that are with no preconceived, like you don't have a cold and then before you get it, or you just like your body's more, your immune system is more stronger, so you're not really battling it like some people that are in the hospital? Is that's what asymptomatic is? Like you can go home and fight it yourself, like your immune system can withstand it if you just stay away from people.
Your immune system is strong enough that you're not showing symptoms. Okay. However, you are carrying the virus, and you can spread it to other people. I've known people who've had it in September and are still positive to this day.
Wow. Marcel.
Oh wow, that's deep.
He said, "What exactly, if you can briefly tell us, that COVID is doing to the body? Why does it make a pre-existing condition deadly?"
Okay, so what COVID does is that when people pass away, people don't pass away from COVID itself. They pass away from the complications. And the most common complication that it develops to is pneumonia. Yeah. And everybody knows pneumonia affects the lungs. Mm-hmm. So that's why people get put on ventilators, because they can't breathe. They can't breathe on their own. They can't meet the oxygen demands in their body. And as far as pre-existing conditions, it lowers your immune system. People with hypertension, obesity, diabetes, all those things, it lowers your immune system. So that's what makes you susceptible for catching it. And
that's the best
even if you don't
I have heard.
In conditions, you can still catch it. So, I mean, they really don't tell you all this. It's like you have to deal with it enough to kind of like rule out, basically you figuring it out on your own by being exposed to it.
And I think that's the hard part for everybody, is because people are trying to like do what they can to build up their immune system, to build up their, and then still try to stay away from people. But also, like the way the world has opened up, people are like, man, but I want to get out this house. I've been in this house since March. I want to go somewhere. I want to do something. Or if I'm not out publicly, I at least want to be around some other people. But being around other people is when you could probably catch it the most. And so it's that catch-22, you damned if you do, you damned if you don't. So I think that's what's making it harder for people, because a lot of people want to be able to get out and do stuff, because some people literally have been in the house since March. And they're trying to figure out, okay, if I go here and I go there and I do this and I do that, I'm one of them people that if I don't have to go nowhere, I'm pretty much not. I've been in the house. I'm gonna sit in here. I'm gonna do my business. I'm gonna work and all that other kind of stuff, because I really ain't trying to go nowhere. And I take my vitamins and all that other kind of stuff. But at the same time, I get nervous about being around other people. I get nervous about being out and about sometimes, because I'm like, You know, everybody is not cautious. Everybody is not changing their clothes. Everybody's not
No.
washing their hands. People are trifling and filthy. And, you know, if you go in a public restroom, you'll see how filthy they really are.
Mm-hmm.
So, like, you don't even have to go that far. So, us knowing that people are disgusting to a degree where it's like, sheesh, I really don't want to be around people.
Mm-hmm.
So, it's almost kind of like you are, I don't know, like you're like in a bubble, or you're trying to keep yourself in a bubble, but at the same time you want to pop the bubble. It's like I just want to pop the bubble and then go back in it for a hot second. You know, I want to step out and see what I can do, but then go right back in it. But
Mm-hmm.
I think when you step out, that's when it becomes dangerous. So it's hard. It's really hard trying to navigate the waters of trying to be safe, but still have some level of normalcy.
And I think that's what happened when our levels had decreased. Everybody was like, okay, you know, the levels has gone down. Let me step outside a little bit. So they stepped outside. Okay, I'm good. I didn't get sick. Okay, man, this COVID, they lying about this COVID. This COVID is not real. Let me go back outside again. So now they continue to go back outside. And then guess what? Everybody's outside. And all it takes is for one person to spread it to like
The
thousands.
outbreak monkey.
Yeah.
Right. The
And here
little
we are.
monkey.
Here
The
we
monkey
are.
at the party.
It be that one motherfucker that want to hug everybody.
Mm-hmm. And here we are.
I'm a hugger.
We had a question. It said, I heard that people with particular blood types are immune, like someone with O positive. Is that true?
You know, I've heard that, but it's still research being made on that.
Okay.
It's not guaranteed. It's not 100% the truth.
Okay. And that's crazy that some like certain things would make a person immune, like a blood type, you know. And I think the biggest thing when it came down to all of this is like, how many people that it's affected, how many people's lives have been lost, how many of us are still suffering like the repercussions of COVID. Like there are so many people still without jobs. Some people can't go back to work. Some people are still looking for work. People are being put out of their homes because they didn't have a job during COVID. And it's like, it's so much hell happening like right before our eyes. And people are trying to figure out how to still have some form of a normal life.
And it's hard.
And we don't even know what the hell normal looks like anymore.
Right.
So
it's a new normal.
I do feel like it's some kind of X factor that the CDC just hasn't found yet, because again, there's so many people. And I know, Tiffany, you said that, you know, people with pre-existing conditions are more susceptible, and people with, obesity, diabetes, hypertension. But then it's like some people that are asymptomatic have some of those pre-existing conditions as well. So when, you guys just kind of mentioned the blood type, I just feel like there is an X factor, just nobody can figure out what it is. Because everything is very true. And I believe those things, but it's like, again, you can have person A and person B with the same predisposed conditions, and one may just be asymptomatic and one actually get it and end up on a ventilator or die within days. And it's like, okay, well, what's the difference with these two people if they have the same pre-existing conditions and everything is pretty the same? So I do think there's an X factor somewhere. I hope they find it, because maybe if they find it, they can kind of slow it down, stop it, create a real vaccine that's out there somewhere. I don't know.
But then are we even going to take the vaccine? Like, it's a lot of people.
I'm not.
No.
I'm not, because to me, it's like the flu. I've never taken a flu vaccine in my life. All they had to do was tell me it was a live virus. You're not giving me no live virus. I'm good. I played in the dirt good enough. So I know worms and ants and bugs.
You made enough mud pies to know.
My body is good. I'm good. Don't give me no live virus. I refuse to take a flu vaccine. That's why I could never work in healthcare.
Yeah.
So Tiffany, let me ask you this: have you been involved in the treatment of patients with COVID?
Yes, I have.
So do you guys use the plasma treatment now? Are you guys using the plasma treatment where they take
Plasma?
where they use plasma from people that have had it and survived? They take
No, we haven't gone that route yet. No, no. Most of our treatment is medicinal. We just use all medicine.
Okay.
That's
So
a thing they're doing now.
So
I'm sorry?
they have a treatment where they're taking plasma from people that survived COVID and using plasma in their treatment of people that have. So I don't know how successful it has been or unsuccessful, but I know when my mother went in, they were saying that was one of the options they were trying to do, but it was in such high demand that it took 3 or 4 days before you
Yeah.
actually did it. And I think, I think it depends on who you are, your skin tone and what hospital you're in too,
And probably insurance too.
yeah.
Yeah. That's why I say it refers back to hospitals as well too, because the inner city hospitals, you got a lot of people that don't have great health care. So those probably are the ones where it's taking a little longer to get the proper medication to that.
That's true.
And I mean, since Tiff mentioned insurance, we gonna go ahead. That was a good segue, a little bit right there. So, Damone,
What's going on?
what? Because I know what type of insurance do you provide for people?
All personal lines for the most part, as well as commercial. But I mainly focus on life because that's one of the areas where we're lacking as a community.
Agree.
True.
Yeah.
Yeah. So, with life insurance, I know that there are a plethora of ways to be able to have life insurance. There are different types,
Yeah.
there are different categories. So can you give us a little breakdown of like some of the best, like some of the types of life insurance?
Okay. I
And
was going to
then,
say, I'm sorry, go ahead.
no, I was just going to say, give us a breakdown of the types and then like how people would actually know if they're getting more bang for their buck,
Yeah, well, it's all relative. It depends on the person and their needs as well as their family's needs. So, the main two types of life insurance is considered it's called term and then whole. Term is literally just that, like for a period of time, a certain term of years, and then whole is just that, like throughout your entire life, as long as the premium is paid. But I mean, there's no best. Like I said, it depends on what it is that's needed, and it depends on like the type of money you want to spend. Just being honest, typically term insurance is cheaper. Well, I'm like it's inexpensive in comparison to whole life. Reason being, there's a couple of reasons. Now, I deal with people who have been told by agents and producers and brokers to purchase term insurance and invest the rest. Now, don't get me wrong. I sell term insurance. I offer term insurance, but my thing is, a lot of people don't know that term insurance, the probability of term insurance paying out is 1 to 2%. Reason being, a person outlives the term, or after you got a 30-year term policy and 23 years into it, you can't afford it for whatever reason, the policy lapsed. So all of the money you spent on your term insurance policy is gone, unless you're offered a return of premium term. Now, return of premium term is significantly higher than a regular term, than what's called a simple term. But if you get a 20-year return of premium term policy and you outlive the policy, you get all of your premium back, which is good. Isn't any interest. It doesn't accrue cash value, but you get all your premium back. However, if you don't outlive the term and you check out, you've spent more on a return of premium term because it's more expensive than you would on a simple term. So you have to. There's no such thing as a bad insurance policy. The best insurance policy is the one that pays out when you die. However, it depends on what you want to do. If you can't afford a whole life insurance policy, then you go term. As long as you have something, as long as your family has something to fall back on. But I don't advise, but like I said, I like contour depending on the need of the client.
Right. So can you break it down to people that's paying attention, like Marcel wants to know, in terms of numbers? You know, I think that's important to our community to understand the numbers as far as like how much they'll be spending on term or what's the number you'll be spending based on, just different things of that nature.
Well, Marcel is actually one of my clients. That's my buddy. Okay. But it depends.
But before he put that up there, I wanted to ask that too, because I think a lot of people get fearful of the word insurance because they're not sure of how much they're gonna have to spend, or you know, those type of things, because the community is money.
Yeah, well, a lot of people are reluctant to purchasing or even getting information on life insurance because it's not tangible. It's nothing that you can pick up and go somewhere with. It's not mandatory like auto or fire if you have a car note or a mortgage. So to your question, it depends. It honestly depends. It depends on age, prescription drug history, medical history. So there's no blanket number for $150,000 30-year term policy. It depends on who, and pretty much that's that.
So the factors of the person in general that's looking to get the insurance policy, what determines the overall premium.
That's correct.
Okay. Yeah.
So if you fucked up, you fucked up.
I mean, but I can work with you. Don't get me wrong.
So for me, I think that poses a lot of fear in the community, because a lot of people have these. Once they get to a certain age, they have preconceived conditions where they get the health, the heart, and the diabetes and all this stuff going on, and now you start thinking about insurance. But now all that plays a factor into how much you're going to spend on it. So I think a lot of people get fearful of that.
Yeah, a couple things, and I have clients with actually I have a couple clients to be honest, with full-blown AIDS that I was able to insure. I mean, of course, there's stipulations, and the premium isn't like, it's not pretty, but right. It's something,
right?
And hindsight is 20/20.
Right.
So you later on in life, I mean, of course, not judging anybody because everyone's situation and circumstances are different, but later on in life, you look back like, damn, I should have got this when I was 30, because I'll be paying this amount. Mm-hmm. It's not too much you can do about that, but just pay whatever it is if you want coverage. But it makes sense if we reach back, like those with that in that type of situation. It makes sense if they reach back and advise their younger generation, like, man, look, I should have did such and such. Here's what you should probably do now, because it's going to be a lot more. It's going to be inexpensive in comparison to when you get my age. Did I answer your question, bro?
Yeah, yeah, you did. I was reading the question from Ms. Carmichael that she had.
Yeah, I was actually reading that too and getting ready to put it up. But we had also another question from Marcel first. It said, what would you suggest should be a minimum for a life insurance policy for a 35-year-old?
I can't suggest anything because it depends on that person.
Okay.
It depends on that person and their needs, as well as what it is they want to spend.
And their lifestyle, correct?
And their lifestyle, because, there are questions on certain applications asking, like, do you parachute, or do you plan on traveling out of the country within the next 24 months and this, that, or the third? I mean, they're still insurable, don't get me wrong, but there may be a few more stipulations. I'm sorry.
Well, when I said lifestyle, I was meaning more so.
You muted yourself, Kat.
Your mic went out.
Oh, sorry. I know when I said lifestyle, I meant more so like, I know when we insured ourselves, it's more like, what do you want this to do? And I think you kind of mentioned that, something like all those different variables. Do you want to pay off your house? Do you want this paid for? What's your actual income? Does it make sense? You make 60, 70, 80, $90,000 that you have at least 150,000, or depending on what your mortgage is. So that's kind of what I meant when I said
okay.
Style. Or are you just a person that works, a minimum wage job, and you just need to make sure you got money for your family to bury you, and you don't have a lot of debt and stuff. So that's kind of what I meant when I said lifestyle.
Yeah, when I speak with clients, I go through all of that, like with the fine tooth comb, because I always want to give a person what it is they need. I'm not going to try to give you what you ask for if you're really not educated on, life insurance and how it works. We're going to go through all of that just to figure out your needs.
So I think you just answered that question we was looking at.
Yeah, and I'm still read it anyway. Miss Carmichael, wrong one. Miss Carmichael said, Damone, do you educate people on the benefit of a whole life since it's more expensive if they wait longer and this guaranteed burial, or do you focus more on the term? I think most people look at the total value opposed to ensuring their family can give them a proper burial, which is less than $10,000 without having to do a GoFundMe or fish fry. Most people look at insurance as a get rich quick option.
Well, there are some burials that are a bit more expensive than 10,000.
Yeah,
but I mean,
I think it depends on what
it is you're looking for in the whole nine.
Because I know, in Georgia, you can get a decent burial for about. But like up here, a decent burial up here when you want the casket and the whole nine and the blah blah blah, it can get up to 20,000. Easy.
Yeah. And as far as what you say, most people look at insurance as a get rich quick.
I think those are the family members.
Hear me out. A lot of people look at insurance as a get rich quick, and it works for them because a lot of people have their, excuse my French, have their shit structured to where their grandkids don't have to worry about anything. It makes sense if we start to look at it the same way, because it's hard to get out from behind the 8-ball, man. When you live there, you've been living there. Yeah, we've had it hard, keeping it real. We've had it hard, and we're used to it. We know how to survive. But when you can if I can put my grandkids who don't even exist in a position to exist and not survive, I'm going to do just that.
I think as a community, I wish we were more informed earlier than the generation now is being informed, because I remember being a manager, a couple of years ago at a restaurant, and I was talking to people about insurance for my employees, and he kind of explained to me, like, at 20 years old, if you just start saving $5 a week or $5 every 2 weeks, by the time you retire, you got $1 million, $1 million plus dollars. I was like, well, we weren't educated like that at a young age.
True.
To understand that, $5,000, I throw that down the street. You know what I'm saying? Like,
what I'm saying? Like, who you throwing it at, mouth? Who you throwing that $5 at down the street?
I've been to a few strip clubs in my life. But I'm just saying, like, to have that knowledge, to understand, like, something as frivolous as a $5 bill or $20 bill that we blow on frivolous shit, that could have changed my life where I'm at now. Like,
yeah, that's real. Yeah, or you can look at it like this: transfer the risk. So that same $5 a day or whatever, purchase a cheap life insurance policy. I don't care if it's term or whole life, but continue to save. So now, if anything happens, your family's gonna get a lump sum. But the money you save, now you can play with that money. So that's like I said, transfer the risk is something to think about. I've taught my son, and he's only 20, and dog got his shit together.
That's good shit. That's good shit. So now I think for us as older people, as myself, I guess I put that, I guess
I'm 22.
It's time to go back and be re-educated. You know what I'm saying? So it's interesting.
It really is. And I think a lot of us, when we have these jobs and we apply for insurance, we don't know a lot of the shit that we checking off in those boxes. We just be like, I'll take 50 grand and y'all can take that shit out my check. Other than that, people don't even know what they're signing up for. They don't know any of that information. And I know that I was one of those people. I was like, I don't know what the hell I'm clicking or signing or checking this box for. All I know is I'm putting my mama and my nephews on there for beneficiaries at that time, you know, when I was when my mom was still living. It was like my mama and my nephews, that's who I'm putting on there, and then that's how we're gonna keep that shit rolling. But now I'm like, yeah. And so I even made sure I
have to
called
say this.
Damone, and we had a couple of conversations, and we still finna have some more conversations because I still need some more clarity.
And you know, it became. I think it became like a gap between from when it was family and community, and then that era where we went through the crack era, and then I think that's where it lost term because my grandmother got insurance out the fucking wazoo. She got a 1,500 here, 10,000 here, 3,000 here, 4,000. You know what I'm saying? And she had, and you know, I used to remember as a little boy seeing the man come to the house.
Seeing the insurance man come to the house.
You know what I'm saying? And
you old.
And now because when my mother passed, you know what I'm saying, she's going over all this stuff with me, and I'm looking at all this stuff she got. I'm like, I remember the little fat white guy coming to the house and you give him 50 cents. And you know, but now, you know what I'm saying, it's paying off. But then I look at it like my mother's generation, the crack generation, they got kind of lost in that, which kind of
You muted yourself.
I did the cat, my fault. It kind of flipped us around a little bit. So I think it's interesting. I think it's super interesting. I think what you do is important, and I think it needs to touch the community more. In the I say in the 50 to 35 age range, we need to reach out more to that community so they can understand, because that's where we lost at, from that 80 to 2,000 range.
Mm-hmm. Send them to me, bro. That's all you gotta do. Straight up, because
everybody that needs some insurance, hit my man up. Tell them how to.
not even so much as need insurance. If you need because I tell my clients, and a few of them are in the comments, I don't sell insurance. I educate you and help you come to whatever decision or conclusion you need to come to. Now, if you use me, I'm not going to say no. You feel me?
Right.
But definitely, I mean, but I think that gives you the purity of what you do. That you're willing to educate people, and they understand that, and then that actually is going to bring you to business because you're being honest with it, you know?
Yeah. Like my sister, Tiffany, she had me. What was that? Open enrollment last year, boy. She had me working, Jack. I mean, working. But it's not a problem because, like I said, a lot of ages, let me say this real quick. I'm trying to get people to understand that everybody or everyone who sells or provides insurance isn't in it for the quick bucks. Because we have that dark cloud over our head saying the only thing you want is the commission. You're just interested in the commission. I mean, I'm going to figure out a way to eat. So I'm not in it for the commission. I'd much rather educate you so later on down the line, you can educate your people. Right. Make my job easier. Make the next good insurance producer, broker, agent's job easier.
Right. So
it's not about the buck for
you gotta ask in every industry that you go in. You know what I'm saying?
So yeah. But there's a whole lot more in my industry,
right,
bro.
So I think people just like with anything, you got to research and take your time and really look at the soul of a person when you talk to them. You know what I'm saying? Look at me in their eyes. Like I can see in your eyes you're sincere about what you do.
Oh yeah, I love what I do.
You ain't on a whole bunch of BS, you know what I'm saying?
Nah, I love what I do, and I love helping my people.
Tan said that her grandparents had policies and plots. That was definitely one thing that a lot of older people made sure that they had. They paid for their plots, they paid for their policies, they paid for those things ahead of time. And I think a lot of us are even scared to even think about having to buy a plot that we don't even like think about the importance of doing those kind of things, because our families end up buried all over the cemetery. And then we like, I think she was buried on this side of the
Right.
this pole that was stuck in the middle, but now I don't see the pole no more. And then they didn't turn the mausoleum and then moved it onto the other side. So you
They
trying
done
to
took the
find
tree
your
out. You're
people.
gonna take 20 paces from the tree, make
Right.
a quick
Go 2 spaces to the left, and then it should be 7 rows down from the fence. It's like, wait, what? I gotta go out here and find my people, and you know, and I can say that because it's pretty much like how I have to go. And when I go to the cemetery, when I do go to visit my mom, I'm like, oh, okay, it was the house right here. So her thing was like right on this side of the house and this side of the pole. So it's like you trying to go out there and figure it out. And I'm a person, I'm like, I don't like walking through the cemetery like that. I'm not, I am
brother,
a
let me ask you
punk.
this.
Like, I'm not gonna walk through no cemetery, but I definitely understand the people that were older. The importance of doing so, because grandma and granddaddy wanted to be buried right next to each other, and you know they wanted the kids not too far from them. So that was definitely something a lot of the older generation did that we don't do anymore.
My great grandparents, they had somewhat of a family situation. It's my great grandmother, my great grandfather, and my great great grandmother. They got it where my great great grandmother passed first. So how my great grandmother set it up, they're all together. And then my grandfather, it's a family situation as well where he has one, his wife will have one, and his wife's mom is next to them as well. So they have that situation too, where they bought plots and they have policies.
Let me ask you this. So with us talking about COVID and the COVID situation going on, it has been a lot because I've been through it. It's a lot more difficult and a lot more challenging as far as like doing a funeral, doing this, that, and the third. Has it affected you as far as like people that you deal with? Like if you have to go, like let's say one of your clients, and then they come and because you have a rapport with them and you're trying to deal with them as far as like their payout and what they do and how they get their money. Has that affected the way the insurance part goes?
Well, on the front end, it's affected who's eligible. Reason being, you know, they added a few more questions to the applications. And one company that I will offer policies through in May, as of May 1st, they like cut off a lot. You had to be under 70 to get a policy. And if you're not under 70, you have to get what's called a single premium whole life. So if you want a $50,000 whole life policy and you're 71, you had to pay like upfront a single premium. So if that premium was like $28,000, you had to pay that up front. But for the most part,
That's a lot.
yeah, but with its whole life, so there are there are a few benefits to it.
That's
you
true.
know, but for the most part, it hasn't been. I've been able to insure everyone that has reached out to me since COVID, one way or another.
So I'm on the same page as Miss Genesis, and I was thinking this. I was waiting until you got through. For you, if you could kind of tell our viewers and maybe even some of us, because I do know that when we start talking about death to our family members, whether they're young or old, and you need a policy, a lot of times for whatever their fear is about talking about it, they're like, oh, I'm going to be here forever. We ain't got to talk about it right now. Or we can talk about that later. And they always put it off. So do you have any suggestions to bring this up to your loved ones, to have this open conversation and dialogue, to put these things in place that will make it comfortable to talk about, or kind of lower their guard a little bit to have those conversations?
Honestly, it'll never be comfortable. It'll never be a comfortable conversation. It has to be. Usually, it takes a tragedy for someone to be responsive or susceptible to the information that they're asking. I just being honest, like after someone passed, I get a lot of phone calls from family members because they see that shit can get real. So as far as having a conversation to like ease them initially, typically it's usually when they experience a tragedy. And I've been doing this for a decade straight, man, and it's not going to get easier, especially just being honest, especially dealing with like certain communities. It's not going to get easier, but that's when like the perseverance of the producer um, basically comes out and leads the way, because the only thing I need from you is a conversation. I don't need any commitments. I don't need any of that. I need 15 to 20 minutes of your time, and I'm going to ask the real questions within those 15, 20 minutes. Like you asked about life insurance. What you want life insurance for? What do you want it for? If you don't have life insurance, who's going to take care? How will your kids be taken care of? Simple questions, and that typically makes a person think. Like, it makes a person think like, damn, I never looked at it that way, or man, my baby gonna be messed up, or I always wanted to do this for my nephew, and if something happened to me, I don't have enough, or I don't have anything, so they SOL. But it's just it's those type of, and I implore you guys to ask your family the same questions, the hard questions. If such and such happened, what you gonna do? How we gonna do such and such?
Yeah, that's literally like what's rolling through my head right now. Like sitting up here thinking of all those questions. Like, because when we lost my mom, it was a lot. I mean, a lot. She got sick all of a sudden out of nowhere and was in the hospital from April up until the time she passed in June. And so during that time, we were like, what we gonna do? How we gonna figure this out? How we gonna do this? How we gonna do that? How we gonna, and then everybody was working, but in shifts. We were in shifts. Somebody was at the hospital, everybody was at work. When everybody got off, we were switching it out. Like everybody was on rotation. We had it down pat how we were doing everything. But then like we later found out that the insurance policy that she had wasn't a insurance policy to cover everything. So like we legit had to go through a whole bunch of different odds and ends to figure it out. And then we ended up coming out of pocket to pay for our headstone and things like that ourselves. So we were able to bury her, but it was like, whew,
it was a fight.
Who thought about that? And I know when we had our conversation about insurance, I mentioned that like, nah, I ain't trying to leave and have my family out here stressed out about how they gonna bury me. Nah, listen, y'all go ahead and turn me into a few ashes. Spread me on the waters of Lake Minnetonka and going on about y'all way. Going on about y'all merry way. Like I
think a lot of people are going to that.
Yeah, like I don't want my family to go through that trouble. Like my wish is, listen, I'm a woman of the water anyway. Go ahead and put me in some water and let me go ahead and be with the Lord. I just don't want that stress. I don't want any of those problems,
Hey, that's me. I told her, I'll be like, y'all can flush me down the toilet. Like it ain't like I'm a no. I'll be like, don't.
Not
don't
like
spend,
you ain't gonna know.
I tell my kids, I'll be like, look, take $1,000 and throw a hell of a party because your dad wants to have a good time. And the rest of that money, live your life, buy your car. You know what I'm saying?
Do something.
I don't know shit. What the hell I need a $10,000 casket for? For what? I don't need to put a suit on for what? I came in butt ass naked. I'm gonna leave.
Well, and that's why I said I think it goes back to your lifestyle, because like when my father died, well, two things. One, I think, like you kind of said, Mouth, it goes back to our family and what our family did for us. When my father passed away 20 plus years ago, he had so much life insurance and so much investment stuff, and just how he lived. That funeral cost me an arm and a leg, but I gave him the service and bought the things that he was accustomed to. My father lived in Europe for 25 years. He was used to having the finer things in life. So that's how I buried him and still had a whole bunch of money left over. But like when my mom had last year, we had insurance on her, and it was enough. She had a moderate funeral. It was nice. It wasn't as elaborate as my dad's funeral, but it was nice. But, the difference was, my dad died. I got bukus and bukus of money. My mom died. I think me and my sister only out of the deal after we paid for everything only ended up with a couple of $1,000s a piece, which was fine because we wasn't looking to get rich off of my mom anyway. We just wanted to make sure that we could take care of her and whatever her needs were, and we were able to do that. But again, it goes back to, like you said, we have to educate our children. We have to educate our brothers and our sisters and our nieces and our nephews. And I think like Tanya had mentioned in the comments, have those conversations and explain, it's not about you're going to die, but it's like, hey, like you said too, Mom, like who's going to take care of this when you die? Because
that paperwork got to be in order.
Nobody. Like we going to take care of this like right now.
Like these living wills and these hospital wills and the death wills, those things are important, and they're free. Like you can go online and download them.
You Google.
Right. That's it.
I am my mother's. Oh, go ahead, sir.
Go ahead, baby.
I am my mom's only child and my grandmother's only grandchild. So I would randomly, I haven't done it in a while. I would randomly ask, y'all still got y'all life insurance together? And they would just be like, what?
You should.
I have to, and I haven't done it in a while because in the last few years we had a lot of death in my family. So I try to ease up off of them. But with my mommy and my mother, because my dad is deceased, so I'll sit with her and I'll talk. And I asked her, and we've had it was morbid and I hated it. But she had surgery and it was a routine surgery, but even routine stuff can go left. So I said, if something go left, what do you want me to do? She told me what she wanted. I was shook. I'm like, man, I don't want that position. However, your insurance, are you good if I have to make that? She's like, yes, please stop asking me that. I'm the only one. Listen, I am the only heir. If you want to, if you want to make it cute, I need to know what do you need me to do or where's everything. And even with my grandmother, I just yell in her room, "Hey, your life insurance good?"
Hey yo,
swear she's like, "Huh?"
Yeah,
she's like,
yes, we paying them premiums.
Yeah, and she'll be like, "Yeah, I haven't done it, especially with my grandma. I haven't done it in a while, but I'll probably after this conversation." Probably not, because my mom did just lose her best friend. But maybe in the next few weeks, I'm gonna be like, "Yo, Ma,
you still solid as a rock? You still solid as a rock?
You still good?"
With the wink and the gun.
Right.
Yeah, because a lot of my friends have had to bury their parents, and it wasn't easy. And my mother does. One thing about my mom, she keeps her financial affairs in order. Good. So I do know that when it is her time, God forbid, I won't be a guy and I'm like, I don't know what to do. Because she's just like, she's very Rain Man when it comes to stuff like that. But I think in the next month or two, once she's okay, because she just lost her friend, I'm gonna ask both. I'm gonna ask my grandma. Hey, at least my grandma, you still good? But my mom, maybe next month. But they're very
maybe next month.
Just put it on the calendar.
Because the conversation is very uncomfortable, but I have it. I do.
Tan said that she has families who come in the funeral home with no insurance. However, again, it is about priorities. These folks will still bring $200 jeans, a new pair of Jordans to put on deceased, and the whole family have on t-shirts, yet they do not have money for burial or the cemetery. Yep. We all know if you don't have the money for opening and closing, there is no funeral. Wow. And I remember Tan telling us that she works at a funeral home, and I'm like,
she used to do makeup and hair and stuff.
Yeah, but her
what a body just sit there.
You would not think. Yeah, you would not think. Knowing, like meeting Tan, you would not think that that's what she did. Like she's so like bubbly and like silly and all that.
This some of her work right here. This some Tan work right here.
Wait,
what?
That's what I want to do so
Where did you pull that
from? That is my dream job. I want to be a mortician.
I have a 19-year-old daughter. She's not here. She actually.
You want to be a mortician?
Oh.
It's actually pretty cool. I know someone.
Since I was a little girl, I guess because when my dad died, that was my first, like funeral or whatever of someone I knew close, and I wasn't afraid. And that made my mom and grandma go, this kid is not shook, and this is her parent. I was sad, but that is literally my dream job, is to work in a funeral home. I know it's a little odd.
I definitely wanted to ask this question because Marcel asked it a little while ago, but he said, how do you feel about retirement apps like Stash and Acorn?
I was going to ask you guys to put that up. Whatever works, man. Honestly, whatever works. If you're seeing gains through those investment apps, follow the market, because I had several clients come to me crying, some literally, because when COVID hit, their 401ks took a dive. And if you know, and I'm going to segue into something else, but yeah, just follow the market, educate yourself, and if it works, it works. Know when to hold them, fold them, walk away, and run. And what was I going to say? Damn, I forgot. But it happens. I'm old now. But yeah, there are different products out there. You want guarantees. When it comes to you can use life insurance for retirement as well. A lot of people don't know that. Those are some of the living benefits of a whole life policy. So you can structure your portfolio with minimum, moderate, and maximum risk. Maximum, of course, playing the stock market, the S&P 500. Moderate is, and a lot of people don't like the term annuity, but there are some things called fixed annuities, fixed index annuities, to where your money is invested, and if there's any profit, you share within the profit with the company. So the profit is 50-50. However, there aren't any losses, because if just say whatever you're investing your money in, if it tanked, then that's why it's called fixed. That's why you're sharing into the profit. That's why you're sharing the profit. So if we up $1,000, I'm gonna give you 5, and I'm gonna keep 5. Say I'm the company, I'm gonna keep 5. But if we go under 0, if we negative, you're gonna stay at that 5. Wherever you are, that's where you're gonna stay. That's moderate. And minimum risk would be a whole life insurance policy, because that way you can it accrues cash value over time, and I call a whole life insurance policy a volatility buffer. So if the market tanked and your 401k is affected, and I've spoken with Tiffany about this several times, both Tiffany's actually. If the market tanked and your 401k is affected, your IRA is affected, or your mutual funds or whatever is affected, you can live off, depending on how you structure your whole life policy, you can live off of the cash value until the market heals itself, so to speak.
Yeah, I do remember that part of the conversation, because I was like, oh.
Yeah.
Okay, then, because it makes a lot of sense to be able to, like, you're reaping the benefits of what you've already been paying into already.
Yeah.
And you don't have to wait until, like, you checked out of here and your family gets to reap those benefits. You actually get to reap the benefits of you being a responsible adult.
Mm-hmm.
And so, being that I want to be a responsible adult, I'll be calling you this week.
I already know.
Listen, I just told my friend, like, I need to grow up. I'm ready to grow up. I'm ready to say, I'm a big kid now. Like, I legit, like, it's a lot of things that I overlooked or took for granted until all of these things have started happening within the last 5 years. Like, I lost my mom, I lost a best friend, my uncle, my aunt. I've lost a lot of people within the last 5 years, and I took all of those things for granted as far as insurance and, the benefit of those things. Like, I know about insurance, and when I had a regular gig, I definitely signed up for it, made sure it was paid. But now that I'm not working a regular 9 to 5, I'm like, well, you still need some coverage, little girl. Because you never know what can happen or how things are going to take a turn, as we see with COVID. Like, a lot of people are out here suffering and trying to figure out how they're going to live their day-to-day lives simply because they do not have or did not have those options to be able to use their insurance and things like that to be able to cover themselves. So yeah, I'm probably gonna get on your nerves this week.
No,
I'm gonna be texting you like a mom.
I think that everybody this. And if they don't call him, I just highly suggest that you guys call somebody for your insurance needs, because the one thing I can say is I'm not an insurance salesman. I don't sell it, but I do. Everybody I talk to, I always encourage them to get insurance, because I buried my 25. I buried my mother at 43. And when I tell y'all, I was never more at peace than to walk into that funeral home and everything was covered and it was so not stressful. I didn't have to ask nobody for a dime. I didn't have nothing to worry about. It was like, hey, here you go. Yep, do what you got to do. This is what I want. We didn't have to stress about anything.
That's the main
thing.
So
easy. It was a piece of cake. It was like in and out, done. And
that's
just,
the main thing.
That took a lot of pressure off of even dealing with the death itself, because that was just one less thing that I had to worry about. I didn't have to worry about, oh my God, like y'all, somebody said, who gonna pay for the opening and closing? Who gonna pay for this? Can we afford this? Oh my God, what about the obituaries? Didn't have to worry about none of that. It was a piece of cake. And I thank God that my father was a financial genius that he was, and made sure that all these things were in place. So I highly encourage everybody, even get insurance on your little babies, your little 1-year-old, 2-year-olds, when they born, when your nieces, nephews, grandkids are born. Take out a Gerber life policy. Like, get it when they're young. They can cash it out, whatever. It doubles. But like, I don't know, y'all get excited to talk about insurance because it's the best thing since sliced bread. And I done had to do it.
You had a great experience.
And Tam made a
just
really
having
good point.
Insurance made everything so much easier. Yes, absolutely.
Tam made a really good point.
Let me
She
ask you
said
this
if you
question,
pay
brother.
a cell phone bill monthly, you could pay for a monthly policy.
Amen.
Listen, you ain't lying, Tam, because I pay Verizon and I'm like, Verizon ain't cheap. So Damone,
Yeah.
be ready to swipe my
Verizon
card,
go up
okay?
without
Be ready to swipe my card this week, okay?
I got you. Quick question for you, man. As an insurance agent, are you able to provide insurance all over the US of A, or are insurance agents licensed in an area?
Well, you have to be, it's called resident and non-resident. So my resident state will be Illinois, but I have 11 more non-resident states. So only thing I have to do, if someone is interested in insurance and, we speak a couple times and they want to, go forward, only thing I have to do is log on, get on my iPad and pay for that license in whatever state they're in. So it's not like you have to pay per state. You have to pay for your licensing per state. And I mean,
yes, Tanya, those Gerber policies are the best. And make sure, Damone, you put your information in there too.
Oh yeah, okay. I'm definitely gonna put his information in here, or even on the Phat Girl Chronicles Facebook page as well, so that they can see it and be able to contact you. I know there'll probably be a lot of people flowing your way.
That's not a problem. That's not a problem.
I'll also post it on my personal page as well, so that way people can know, how to contact you after this the show tonight, because there are a lot of people who don't understand the importance of insurance. I definitely learned a lot about it in the midst of everything taking place, and even recently, like taking care of my aunt's funeral services. I wasn't the person at the funeral home when my mom passed. I was there when my aunt passed, and I was like, is this what y'all was in here doing? Like,
are you gonna put Tiffany information on? Somebody might want to contact her on some COVID stuff. I don't know.
I didn't say I wasn't gonna put Tiffany's information on there, but I'm her name and information. They're both tagged on the information for tonight. For the show tonight. So I definitely put their information up there.
I'm just tripping.
But it's definitely a different feeling when you are in that funeral home and you have to deal with the services and things like that, man. Because I wasn't that person when my mom passed.
Different ball game.
I was the person when my aunt passed, and it was like, I'm finna go outside. Give me a minute. Like, it's a whole different ball game. And I was like, I don't want, no. I don't want to do this no more. So, I definitely want people to understand the importance of it. Actually, have a a way to contact someone with information that can educate them the best way possible on a variety of things. And yes, Tanya, power of attorney is important. I have
Definitely.
seen a lot of situations go left because family members decided to fight over certain things
Man,
and
that
nobody had the
breaks up
power
the
of
black
attorney.
family.
Yep.
Excuse
That
me.
breaks up the black family.
That actually, like when my aunt passed, I was at the hospital. Went to the hospital, tried to get the keys to her apartment and her wallet, and they said, "Well, we got to call everybody on this list that's listed as a contact
Emergency
to
contact.
make
Mm-hmm.
sure that we can give you this wallet." I was like,
Mm-hmm.
And people do
"Oh,
need to know too that there's two different power. There's actually a separate medical power of attorney as well.
Right.
yeah."
It's
And
a
so
medical.
it was a learning experience as far as me being like the person in the forefront of everything. I was like, "Why y'all got to do all of that?" Like, I
Man,
need keys to her house, like I need to
man,
get the ball rolling, and I can't do that if y'all still got her keys in her wallet.
man, let me
So it was
tell
a
you.
whole different
When my
situation.
mother
So it was a
passed, we
lot of
learned
learning.
everything. Like I've learned, like, okay, you got to get these will done. Once you get the will done, get them notarized. Make sure you take
Right.
one to your local city hall so they have a copy. You have a copy. Make sure you go to the bank to get the bank accounts that you need to. Make sure all that stuff is filed in the city courthouse, and that way you won't have to deal with all that probate bullshit.
And that's a good thing, Mal, to
Yeah,
answer Tavana's question. She said, "What happens when that doesn't work if it's voided?" And that's what will happen. It will go to probate.
right. Yeah, definitely go to probate, and that can be a long, drawn out to do about nothing.
Mm.
There's
Yeah.
another reason for the black family to be structured, and we allow it as well.
Yeah.
Yeah, because we've seen a lot of a lot of things go left on like via social media because families get into it over
Absolutely.
funeral services and things like that. I remember when my best friend, her brother passed, and like the next hall over, it was a family that you thought it was Royal Rumble in that funeral hall because somebody owed somebody some money, and they came in there saying that this nigga in this casket owed me some money. And it
Wow.
got way disrespectful. And next thing you know, it was Royal Rumble in that joint. It was men fighting women. It was women fighting women. It was ridiculous. And I was like, I had never seen anything like that in my entire life. And next thing you know, the
Wow.
funeral director got everybody out. He locked us in the hall that we were in. And next thing you know, you heard gunshots outside. So it had
Wow.
got like seriously for real because people are for real about what. And it's like I had never experienced nothing like that in my life, but to see how serious people are when somebody passes away about money and property and things that don't even matter anymore, like that experience along with the personal experiences I've had, yeah, it's for real, for real.
Tavana just touched on something that I was a tip that I was going to give. She said, make sure you list beneficiaries on your accounts so you don't have to deal with probate. I was gonna, I tell everyone, like, no matter who your agent may be or who you've been working with, write down or email yourself a copy of your life insurance policy numbers, the companies, and the beneficiaries, and email that or give that letter to the beneficiaries or whoever, because I've delivered death claim checks and the beneficiaries was 300 miles away.
Mm.
I've delivered like to the family, to the last known address, and the beneficiaries were 300 miles away. Or people don't even know that they're the beneficiary on policies until, I don't know. And you don't want to do that because after so many years, that money goes back to the company.
Oh wow.
Yeah. So list all of your
the uncomfortable conversation is definitely needed in the Black community. Gotta have it.
Definitely.
Yeah.
Even if they're not like receiving it, they're not willing to receive it. I still try to have it, bro.
Yeah.
You know, I still try to have it because my job is done not when I deliver a policy or something like that. My job is actually done once I'm done educating.
Yeah.
Everything else is on you.
Yeah.
My kids know about my policy, but I refuse to give them a copy because I think one of them kids might try to kill me.
Girl.
I'm serious. Like one of my daughters, I'm like, oh, you a little sketchy. Yo, P, who you dating a little sketchy. Y'all might try to kill me if I tell y'all how much this policy is. So nobody knows how much my insurance policy is, but they do know that they're a beneficiary.
And do they have the policy numbers?
They do. Well, my responsible child, the baby, she has the policy. Like she has all that information, and she knows and who the other beneficiaries are, who is listed. And now my husband has all the information as well. And those are the only two people that can get into where all my secure account information is. But yeah, but I'd be like, I ain't telling y'all kids, no, don't, y'all ain't getting a copy of nothing. Y'all ain't gonna try to kill me before my time to get my money.
and another thing that I deal with, I got to bring this up. Another thing that I deal with is so many people I hear all the time. Well, I got insurance on my job. Are you gonna die at that job?
Hell no.
You know, are you gonna die while working there?
Right.
Because depending on the gig, once you check out, and once you're not working there, then that's gone.
It goes away.
And you don't know if you'll be eligible for insurance later on down the line. So if you have insurance on your gig, that's wonderful. I have group policies as well. However, I got my own thing going. Because if I decide to stop selling insurance for certain companies, then I lose those benefits. You know, so just, keep an eye out for that as well.
Good stuff.
I learned that about myself. I don't stay on job long, so
you got to do your own thing, policies. Right? You got to do your own thing.
I need my own damn policies. Y'all piss me off too tough. I'm out. See y'all.
Yeah, but
so yeah, definitely get insurance of your own, and even additional insurance. Even if you are at that job for a long period of time, like still have additional insurance because you never know what could happen, with that job. A lot of people think they're going to be on their jobs for a long period of time, and then the whole place decides to shut down, and then you're SOL, and you have nothing to fall back on. So it's definitely beneficial to have something on your own, which is another reason, like I thought tonight would be a great night to have this conversation, because it's a lot going on in the world, and we don't necessarily know how things are going to play out and how things are moving. So we definitely need to have, if nothing else, our health and our insurance in order. If you can't fully get your health in order, do the best you can to get to where you can to be in a good space. But also make sure you got that insurance. And even if it comes down, do you help with people in learning about investments, or is it just insurance?
Nah, insurance and retirement vehicles. So yeah, it's I help with any and everything that's gonna either pay your family or pay you once you finally retire. I mean, I've been helping Tiff, and she's I ain't gonna put your business out there as far as how many millions you're gonna have.
She said,
as far as how many millions you gonna have
one time.
Nah, she since I've been helping her for the past year, she got her stuff tight, and of course I didn't make any money off of her because that's not what I'm looking to do. If I can help you, if I can educate you, and what I said, what I suggested, you follow that to the letter, or even if you put your own spin on it, as long as you turn some type of profit, I'm happy. My job is done.
Well, best friend, because that's what you're about to become. That's what you're about to become. I am not playing and I say that simply because I know the direction I want to go in as far as business, personal, and all that other kind of stuff. So having insurance on a lot of different ways. Hi, best friend. And I'm gonna start texting you. Hey, best friend. So what we learning today? I'm definitely a person that I love learning about those things that will help me to be able to get to those different places, which is another reason I try to bring information to the platform, because there are people who want to ask those questions, but they just don't know who to ask. Or they also have too many people giving them the wrong information at one time. And so they have insurance, but they don't understand what they have, or they have investments, so they don't understand how to move in those investments. So it's a lot of confusion, even if they do have the insurance and investments already.
And okay, I'm sorry, you done?
Yeah, I'm good. Go ahead.
Okay. One last thing I'm gonna say to everyone who has insurance or has a guy or an agent or whatever, make sure that they're speaking with you, having an extensive conversation with you at least once a year, because your needs very well may change within that year. So they should be their job. They work for you. Their job is to reach out to you. Just, hey, look, is everything still going the same? What happened? Oh, I just had a grandbaby. Well, maybe you want to do this, or I just lost such and such, or I don't live in the same house anymore. So I sold that house. My mortgage isn't as high. Now I'm renting this $800 a month studio. Just throwing some stuff out there. You may not need as much insurance as you had back when you had a shitload of stuff going on. So they should be reaching out to you. It's not blanketed. Once you get it, you shouldn't forget it. They should be reaching out to you. They should be reaching out to you like at least annually. If nothing else, annually, just to, check your policies, make sure everything is on the up and up. And if they don't, then you reach out to them.
That's good. Yep.
Or me. Whatever.
Or him.
I have a question.
What's up?
Now, I know that some medical conditions causes some people to get refused by some insurance company. Can everybody find insurance?
Yes. There are stipulations to the type of policy, because if you, like I said, I insure a few people with full-blown AIDS. However, it takes 2 to 3 years for the benefit to kick in, for the death benefit to kick in.
Okay.
And I asked him, like, you think you'll stick around for the next couple of years? Because if you stick around for the next couple of years, then without a doubt, if anything was to happen, your family will be paid the death benefit. But yeah, you can get insurance. If I can insure someone with full-blown AIDS, I can insure anybody. So usually people say, well, I'm diabetic and I'm an amputee. I can't do this. I can't. There ain't nobody will give me no insurance. That's not true. That is not true. Like I said, it's going to be a bit more expensive. You're going to have a few stipulations. However, you can get it.
Okay.
That's good. Good information.
Thank you.
There's definitely a lot of good information from everybody. Simply because it's something that's needed. We need to know how to get insurance and how to be able to and for those that have pre-existing conditions, we need to know how to maneuver through that and still be able to get some insurance to make sure that we're taken care of, and so is our family. Yeah. So we've been over here giving some good information. Y'all done gave some good information. There's a lot of
They have.
That's
a lot of answers, so we definitely are going to, post the information for these beautiful people with all this amazing information that they've given us on tonight. So that way you all can go to the Facebook page and check them out, check on their information, see whatever else is necessary for you all to be able to get insurance, your policies, investments, your living wills, and all of that great stuff. So we want to make sure that everybody is doing their due diligence to make sure not only you're taken care of while you're on this side, but your family is taken care of as well.
Yeah.
I don't, I know that a lot of times it is a really hard conversation to have with your family about, the next steps when things are going to or if things come about, but it's a necessary conversation to have because, the way the world moves, shit happens fast. And we're not always prepared for the shit that happens, even when it's moving like super fast. Because life slaps you in the face and then you over there holding your cheek and then wondering how you going to be able to bounce back from that situation. So, Damone, can you give
with
people...
this COVID?
Yeah, definitely with this.
Definitely slapped a lot of people.
Yeah.
A lot of us.
Yeah.
Real quick,
Damone.
just wanted to say what's up to the guests. My bad about being tardy. Work stuff went long,
Tardy for the party. But you here. So hey, Troll.
What's up, Troll? What's going on?
Hey.
I was playing it the whole time. What's up, y'all? So I heard all that good information. I appreciate you, Mone. I appreciate you, Tiff.
Oh, you're welcome.
It definitely was something that's needed. And I'm glad y'all were like open to doing it at the same time, because I feel like they go hand in hand, knowing about your health and all that other kind of stuff, but then also being able to be educated on insurance. And a lot of us want to retire before we hit 60, so you need to be able to know what to do in order to make sure those things are taken care of as well, because we want to live a full life. We don't want to live a life where we are trying to figure out how to get our health in order and we already 60. So you want to do that now. You want to take advantage of all of that now as much as possible. So Damone, can you give people your information? I'm pretty sure they're not going to write it down right now, but they can come back and watch it, and I'll still post it on the Facebook page as well.
Okay. The Facebook page, my Facebook business page is facebook.com/D Smith Insurance Broker. D is in David, Smith Insurance Broker. And my business cell is 847-224-0577. I suggest you shoot me a text first, because all these campaign calls and stuff, I'm not answering on the real. I've had to
be over with tonight.
Man, I don't know. I went in on somebody who texted me talking about Trump. I went in. I had a ball with that. But yeah, shoot me a text or go to the business page, shoot me a message. Tiff tagged me on the earlier promo. So Mone Kong, MoneKong. You can shoot me an inbox. And if you have any questions, I don't care where you are. If you have any questions, I'll do my best to try and get you whatever information is that's available.
Awesome. And Tiff, can you give them your information as well, darling? Just in case they want to ask some additional questions in regards to COVID.
Well, unlike everyone else, I don't have a business page. However, you can reach me on Facebook. It's my full name, Tiffany Splunge. You can message me, 773-875-6393. Or you can just hit me on Messenger. I'll respond that way. I've helped so many people. You'd be surprised. Many people.
Get on Facebook or Messenger. Don't take a number down. Don't get your number.
What was that number again?
Look at that time. What that 774, man?
Oh, she fine. Let me go on ahead and text her. She fine. I'm from the tech fall.
The people who are going through a lot of health problems at home, and any way I can help out, I'm glad to. I've done a lot of
stuff about COVID. But first, what you got on? What you wearing right now?
Well, it is 9:30, y'all, so he free. It's 9:39.
I'm about to say he free to go on and cut up a little bit.
I can't even say nothing.
He was sitting over there like he was sitting over there like, man.
You are well. What's your thought?
He was sitting over there like, so am I gonna be able to cut up tonight or no?
Facebook is hard enough.
I'm gonna be able to say what I've been wanting to say. Them arms was folded and everything. He was sitting there like.
Go get pictures in your inbox talking about, does this thing look like it got COVID?
Ain't about to play with you. Your ass is crazy. Lord.
If I can interject for 1 second, because Tanya was asking about if anybody had butterflies about the election. Y'all know I'm like your numbers girl, statistics, whatever. I just want to say for whoever is into politics, whoever the person is for the presidential election, they need 270 electoral votes to win. Right now, currently, Biden has 131 and Trump has 92. So yes, Tanya, I'm nervous over here. I'm nervous.
Yeah.
Why are you nervous?
Well, because even though Biden currently has 1 and Trump only has 92, I mean, there's still the states that still haven't got their numbers in. It can still go.
A lot of the swing states.
Can I ask a question?
I never liked the electoral college, man. This is so stupid to me, man. Like the state's so small, but it got like so much power in the whole like mainstream of everything. Like a small state can like change a whole election just by the electoral college. When like all the real votes, you could be killing them in that. Like that don't.
Well, you know.
Question.
Yeah, Mone. Cut you off.
Oh no, it's all good. I got a question, and this is for all of us, everyone in the comments as well. If Trump is reelected, what are you gonna do?
There's nothing we can do.
Right. That's all. That's the
last 4 years.
Make sure you get your Second Amendment together and understand.
Make sure you have all your affairs in order the best way
you should have been done that. When they gave us the opportunity for CCW, or if you don't have a FOID or whatever, you should have been done that. Right. I mean, but you get it.
Yeah, I'm going soon.
What's going to we've lived through some tragic stuff. We've lived through what?
And it's even more scary this time because this motherfucker just did all this shit for 4 years and get.
All right, that motherfucker.
Hey, I'm sorry, I can't stand that motherfucker.
But seriously, you know, I feel like it is a concern because I know one of my people that I know that currently live in Texas. I know she had posted earlier that, you know, some of the people out there are going crazy that are Trump supporters, and she was all kind of black bitches today and all kind of other vulgar names just driving down the street, which I know that happens all the time. I get it, but I feel like tonight will be heightened, and I feel like what Chicago is doing in any of these other states. But I know here, you know, they basically said, yeah, y'all gonna come tear some shit up. We shutting everything down. We boarding up these buildings, which is kind of like, oh, let's board the buildings up because people are gonna come tear up and do all these things. So it's just kind of like, you know, I just feel like things are just heightened a little bit, and things do have the potential to get a little crazy. And you know, by me working in that area, you know, it's concerning to me. I probably gonna have to take the next 4 or 5 days off of work.
Get yourself carrying. Get yourself
my little client's gonna be like, Miss Miles, and you trying to send us back to jail? We better ask.
I live in the Porter County area, and they just had a Trump rally. They disguised it as a Blue Lives Matter, but it turned into a Trump rally on Willow Creek this weekend. And so I can tell, and the atmosphere has shifted, the energy has shifted a lot. And I don't usually go out to the world super anxious, but coming home to a predominantly white area had me very nervous. And because they do like to act the fool a little bit in Portage, little slick stuff. And I've seen more Trump flags on the back of trucks with Confederate flags. You would think we was in the South. Riding up and down the street for the past couple days. It's definitely heightened. And it's exhausting. Even with like seeing some of the police out here, you could just tell what they mindset is a little bit. And it's just like I left my niece out. I had to watch my nieces today. I got home and I was gonna get something to eat. I'm like, you know what? I ain't even at home. I'm just gonna take my black tail in this house and sit here because I don't know what y'all on out here. I could just tell y'all feeling some type of way. Indiana gonna do what Indiana's gonna do. It's a red state.
Always has been.
It always has been. So I didn't have my fingers crossed for Indiana. But like I said, living in a predominantly white area, and they got, I mean, it's the biggest Trump flags I've ever seen. Like, who's custom making this shit? Like, it's bigger than the American flag. Like, who's taking the time to make y'all
these motherfuckers?
Fuck around that shit got a Tommy Hilfiger sign at the bottom of it.
Like,
in the corner.
It's one truck out here, y'all. I was doing shipments. This truck had Trump flags, Blue Lives Matter flags. It was another Confederate flag. It was highly decorated, and I was so nervous having to go past this truck. I saw this woman coming down. I was like, I hope she's not getting in this truck. And sure enough, her husband was driving. Like, you married to a whole fool. You good with it? Like the truck, I mean, it was like it was gonna be in a whole fool too. Shit. A whole, yeah. And she was looking at me like, man. I was in my head, I'm like, lady,
motherfucking fool. Where that right through?
And in my head, I'm like, lady, I will mow you over with this Jeep. Get in your car, and I'm gonna go my way. You go yours with your Klansman husband. Listen. Listen. I'm the right one on the wrong day. Leave me alone, man. So I honestly
tell them, tell them. They don't know
David Ruffin. Tell them nothing without David Ruffin.
I took my short black tail home today, and I've been here. I don't know. I don't care what I'll need in the next hour. I'll just sit here because I don't. Nope.
I definitely went and got some waters and some extra tissue and things, you know.
Yeah, we got that.
Like, we don't know what's really gonna happen. I mean, I live up the street from Family Dollar, and I live in the hood, so I ain't pretty much worried. But you know, but at the same time,
I will say if I do go out, I'll go out with someone. I won't go out alone
by yourself. Yeah.
No.
That would definitely be
whenever Trump does something, I'm not gonna lie to y'all. I don't go by myself because, like I said, I do live out here with all these other not melanated people. And they still look at me and my family like the audacity of y'all moving to Portage with your black asses. And so it's very that some of them, they be good. They're like, hey, how you doing, color? It's like, hi. The others
are like, hey, it's real out here, huh?
I actually still use that word.
Some of my neighbors are cool though. Like some of my neighbors are like, "Are you guys okay?" You know, but some they still like they don't. There goes the neighborhood. Cause I pull up blasting Young Dolph. I don't care, and they just like, But it's definitely a different
this Negro
outside. Right,
this Negro in our neighborhood.
Look, this short Negro. Like I could tell that's what they saying. What they're doing. But it's definitely heightened outside right now. It's not a fun place to be.
Antoine said if it jump off, he gonna grab the heat and go to his grandma's house. Hey, listen.
That's the best way.
You always safe at Granny house. You always safe at Granny house. Because you know your grandmas are low key crazy, and they probably got like a rifle. They got a pistol.
They got that
Saturday night special at 38. You feel me?
They got shit hidden in the house, you know. And then you know, grandma got beans.
Sleep with that bitch on her pillow.
She got beans, greens, potatoes, tomatoes, all of that in the house already.
If it go left, at least you don't eat. Listen,
that's what I'm saying.
My grandmother Elizabeth, so. If things go left, at least I know I left here with macaroni in my belly. Oh,
that's comedy.
Y'all right?
That's how it's cool. Always gonna be
in my house.
Right. She said macaroni in my belly.
Listen, because grandma gonna have them. She got probably some preserves that she done made 3 years ago that's still good in the shelf. You know, she got it buried in the yard.
My grandma still got a land. We have a landline because of her. We okay. This is a bunker to me. Like, we're good here. Like,
okay, Kimmy Schmidt, you got a whole bunker. You ready? You is prepared. I ain't mad at her though. Like, I do think a lot of the stuff that's happening right now, like, we do have to be prepared for survival, and a lot of us aren't. A lot of us are not ready. A lot of us are not ready for those survival techniques and things like that. So if you're not, you better find somebody to be around that know how to do some things, bury some stuff, go fishing. I know how to fish. I know how to fish. You know, I don't know how to clean it, but you know, I know how to bring it in. Y'all better figure it out.
The fact that you have the skill, though.
Hey,
you have the skill to fish. So,
hey, cause you know that's what happened when you date a fisherman. You know they make you get out there like, hey, I'm going fishing. Oh well, I'm going too. I don't know nothing else. I don't know how to do nothing. But I learned how to put a beam off on the hook.
Skill.
I learned how to put a beam off on the hook and throw that thing in the water. That's pretty much all I know how to do.
Yes.
You know,
I'm one of them girls. I do not have.
I look like a girly girl, but I like getting dirty. So I go out there and play with the bugs and play in the dirt. No,
I mean, I could survive. I'm not gonna lie, I could survive.
Oh, this is a politics show. We're not talking about your sexual desires and all that.
No, we were not. We were talking about I like to play in the dirt and I will play with bugs.
Oh, you said dirty. I just
for survival necessity.
I didn't know this was gonna end up going there. We was doing so good.
Because
doing so good.
Because you know how he is. It's always gonna go there with the mouth. It's always gonna go there. He's always gonna be.
Man. Be prepared for whoever wins. I'm just gonna say that as people. Be prepared for whoever wins because they still gonna feel like
they still gonna act a fool.
When you see an old white woman on a video feel like she could just say nigger from the gut of her soul, and they done open it, but they got a light on them. They feel like they out in public now. They can really be out in public.
They ain't gotta hide no more.
But the first time
he made them okay. He made it okay for them to bring out their racism.
I'm with you on that. I'm with you on that now. I am with you on that. The first time you think you finna go ahead and call my big black self one of them N-words.
The mouth little square will be black that week. Or the next week. Unless I can do a live remote from jail.
We gonna put a little filler circle right there. We're gonna put your picture up. You know,
I'm gonna be at county. I'm like, I gotta call Leo so I can do my segment. They gonna be like, what you talking about? I have a job. Before I beat her ass, I had a whole job. So let me call Leo so I can do my part. Thanks.
Right. She gonna be like, listen. She like, hey, listen, I'm supposed to be talking about some celebrity gossip tonight. So.
Gossip. And I got some tea for y'all from inside of jail cell number 7. So this is what happened. I was in Family Dollar. And
why has to be Family Dollar? Listen, the Family Dollar by my house goes up.
Family Dollar. I don't know why. I guess something comes over them. I don't know.
Family Dollar goes up. Family Dollar goes up. Like
I will beat you with this overpriced Summer's Eve, sis. I will beat you. Don't do that.
All right.
Not overpriced.
To the Phat Girl Chronicles. That's the show right there.
Right. Well, so I thank y'all for being on here tonight, joining us with all of that dope ass information. Of course, we always gonna have our comic relief. We always gonna have our bullshit conversation because that's what we do from time to time.
Usually, I'm in the comments.
Yeah, I was about to say you on the other side of it tonight. You on the other side of it tonight. But so I did say that we had a big announcement that will be announced tonight on this show.
Okay.
So y'all ready? Drum roll, please. So starting next week, the Phat Girl Chronicles will be a syndicated show on JQLM Radio. which is an internet radio station based out of Indianapolis. We will be heard across the U.S. and other countries that JQLM Radio will be that JQLM Radio broadcasts through. So you can definitely check us out. You can check us out on jqlmradio.net. Don't quote me. I think that's wrong. But I'll definitely post the information where you can find us. But you can also now stream us through JQLM Radio, which you can find on the TuneIn app. And you can, if you have a Apple or iPhone, you can download the TuneIn app, type in JQLM Radio, and you will be able to stream us there. Or if you have an Android, you can just download the JQLM Radio app and tune in. They already have a few Cheryl Underwood shows that are syndicated on there. They have a few other dope podcasts and radio shows that play music. They also have JQLM was the show where the Phat Girl Chronicles started. So we are going back home, as I like to call it. We are going back home and doing our thing with JQLM Radio. We are excited to be back. Yes, sir. I told y'all that I was not playing this time around. When we came back, we were going up. We were doing our thing. So we will still be on every Tuesday from 8 to 10 p.m. Now you just have a different way to tune in and listen to us. So if you can't join us live, you can join us on JQLM Radio. Or if you can't join us on Facebook, you can check us out on YouTube. And if you aren't, they going, baby. It's going up.
Theme song is coming to mind. Theme song coming to mind right now.
Tell them all the platforms where we at. You know what I'm talking about?
Yeah. So also, the podcast is available on Google, Apple, iHeart, Spotify, Amazon, Audible. Anywhere you can listen to podcasts, you can find the Phat Girl Chronicles. You can find us on Anchor. You can find us on Spreaker, iTunes, Podcaster, and we will be coming on a few additional platforms once we receive confirmation of those things. So when I tell you I'm working, I'm really working. So we are on our way. We are doing our thing, and I thank you for having this dope ass, amazing crew with me every week. The 5 of us on here acting a fool, doing our thing, but we also work very hard to bring really good information to you all on this platform to discuss everything from business to finances, fashion, fun, celebrity gossip, music, and everything in between. So we are here every week on not just a regular Tuesday, because we don't do regular. We do fat. And we do fat as hell on Tuesdays.
Big
so
fat.
we make sure that we make your Tuesdays.
We are the Chronicles. We are the one that come on Tuesday night and make you holler.
Listen, we are not going to use that as the theme song, but you know, we will have some more dopeness coming.
Yeah, did I make you drink your wine like that, Tiffany?
Yeah, it was like, whoa, okay. So if you haven't tuned in prior to tonight, you can definitely go back and check out our previous episodes. I believe this is week 9. Yeah. We've been going since,
let me see. Uno, dos, tres.
We've been going since September 8th. We've been going since September 8th is when we did our test run. So since September 8th, we have been going week by week, nonstop, bringing information, fun, comic relief, and all of that good stuff. So I thank you all for tuning in, getting those numbers up. Also, we thank you all for helping us reach our first 100 plus subscribers on the YouTube channel. So if you haven't done so, please go ahead and subscribe to the YouTube channel, because that's where you can see us live, and you can also comment on there as well. So again, thank you all for always being dope, always tuning in, always keeping the comments going up. I tell y'all every week. Yeah, I keep the comments going up every week. Even if the views ain't up there, the comments is up there.
Definitely. Thank
so
you guys
y'all keep all of that going. We thank y'all. Make sure y'all hit the like, share, and follow button. And as always, we thank y'all for being here. I don't think I can say thank you enough. If you are not following us, make sure you follow us on Instagram, Twitter, Facebook, all of those dope places. And subscribe to us.
Tell them to get at us for some advertisements if we get them some free time.
That's it. I was on my way. Now, if you are looking to promote your business, you can definitely reach out to us to the Phat Girl Chronicles Podcast at gmail.com. We will have sponsorship slots available starting next week when we are on JQLM Radio. So we will have sponsorship slots available, as well as if you are looking to advertise your business in, if you have a fashion or beauty related business. I am the contributing writer for Ego Magazine. So if you are looking to promote or advertise your business in the fashion and beauty segment of that magazine, feel free to reach out to me as well to get that going, and we can make things happen. So, that's it. That's all. That's our big announcement and all of that good stuff that we got going on right here at the Phat Girl Chronicles. And we are just beginning. We got nowhere to go but up from here. So we thank y'all for hopping on this bandwagon, because baby, it's going up.
Right, so we coming to a city near you soon, baby.
Thank y'all. That's definitely what we're doing. We coming soon. But like I say every week before we end the show, whatever you do for the rest of the night and the rest of the week, don't do it with your half ass. Do it with your whole ass.
Your whole ass. Even if your ass flat and your pocket's touching in the back. Just do it with whatever you got.
Do it with your whole ass. Do it with whatever you got. But make sure you do it with your whole ass. We thank y'all for tuning in, and we will see y'all.
Some people ain't got no ass. Do it with your booty. Some people ain't got
2 fingers.
We will see y'all next week. Love y'all. Peace and blessings, everybody.
Y'all be good.
Thanks for the after set.
After set.